There are alarming new numbers out of Ontario's Public Health Agency. Measles cases are on the rise across the country, and public health officials are ramping up efforts to rein in the outbreak. Ontario is the province hardest hit, and in just the last hour, the province's Public Health Authority released its latest count. So we've got with us CBC's health reporter, Jennifer Yoon. She's been looking at the numbers. Okay, how is the picture looking in this province?
So what it's looking like, what the data shows us, is that measles is spreading and it doesn't seem to be slowing down or stopping. So here are the two provinces that are really the hotbeds. Ontario reported 223 new cases just this past week. That doesn't even include some cases that were travel-related, 2 new cases in Ottawa. But the vast majority are part of an outbreak which started in a wedding in New Brunswick and then spread in the community and has been doing so for months. There are 1,242 cases this year so far in Ontario, 9 people hospitalized so far. Most of them are unvaccinated or under-vaccinated children. That is the majority of the people that are getting sick. And the other province that's being hit the hardest is Alberta. The cases there are also increasing at a clip pace. 170 cases reported so far this year, 9 people hospitalized. And there, too, the majority of people getting sick are kids that are under-vaccinated or unvaccinated.
You know, we're talking about the vaccination, and I mean, truly, people do know, I believe it's out there, that measles was eliminated. It was not, a virus, an illness that people were looking at here in the country. And so now we've got the situation where it can be treated by vaccines, prevented by vaccines. And so if it's spreading, as you say, the uptake isn't quite there. So what's the vaccine coverage like then?
So in Ontario, the truth is in some areas we just don't know. I went out to the Halton region because that area is reporting really low vaccination rates. We're talking less than a quarter of 7-year-olds who are fully vaccinated against measles. And I talked to the chief public health officer there, or the public health medical officer there, and she told me that they think it's the record keeping, they think it's higher, but ultimately they don't know. Take a listen.
So because Ontario lacks a real-time provincial registry into which all healthcare workers input immunizations at the point of immunization, Halton Region Public Health, like other public health units, rely on families reporting their vaccines to public health.
So that's obviously troubling because if you don't know where is the worst places, public health doesn't know where to target or which communities they need to really speak to. In Alberta, it's a different story. They're keeping a better track. They have a better handle of how many people are vaccinated, but the uptake is really low, below 50%, as low as 10% in some communities. So there, the president of the Alberta Medical Association is really calling on the government and the public health authorities to step up and spread information about measles, about its dangers, how it can kill 1 to 2 in 1,000, despite having the best medical care, and making vaccines more readily accessible for people.
Jennifer, thank you for this. That is the CBC's Jennifer Yoon reporting. Thank you.